Good afternoon, everybody. This is Justin Hahn again with Washington Wellness Program. I want to thank you all for joining us today for the 2020 Washington Wellness Preview for Public Employees Benefits Program Wellness Coordinators, or Benefits Administrators, or Personnel and Payroll folks, or HR folks, however you might identify. At the very least, what we have in common is that we are all here to talk about worksite wellness and how we can support our employees reach their potential. So I want to welcome you to the webinar on worksite wellness support and resources that the Washington Wellness Program provides as part of the PEBB benefits package through the Healthcare Authority. So this webinar is the official kickoff to begin learning about all the 2020 worksite well-being or wellness support and resources that we as Washington Wellness have to offer. So a note about expectations for this webinar. This presentation describes a mix of new and ongoing Washington Wellness programs, promotions, and resources. So we will do our best to provide comprehensive information without too much review of resources you may already know about. But this webinar is designed to speak to a mix of veteran as well as novice wellness coordinators that make up the population that we serve. So thanks for your patience with that. Okay, so the agenda. So what we're going to be talking about today, we have about 2 hours together. So I anticipate we're going to be well under that today, but we'll see how long it goes with questions, etc. We're going to introduce ourselves, officially welcome you all, which we have already, talk about worksite wellness resources and support that we provide, collaboration opportunities, as well as question and answer at the end of the webinar. So a technical note on how to participate on the webinar today. We have about a couple dozen people signed up for the webinar that are currently participating. So we've muted all the phone lines. And as we progress through the presentation, please use the chat box that is part of the GoToWebinar feature to submit questions that we will answer towards the end of the webinar. And also, likewise, if you have any technical assistance questions, please submit them through the same chat box, and we will do our best to assist. So, and also, I just want to say we're recording this webinar, and we were going to post it along with the PowerPoint presentation as well. So, I have already introduced myself. I'm Justin Hahn, the Washington Wellness Program Manager, and I work with a really very fine team who I'd like to get you to know. One person who's not here today is Heidi Helsley, and she's our health promotion consultant for the School Employees Benefits Board program. But you'll hopefully meet her sometime soon. But who is here is...
Hello, everyone. This is Pam Walker, and I work primarily with the higher education institutions, specifically wellness coordinators, to help support their wellness programming. I also, on the team here at Washington Wellness, I lead training and resource development. And a little bit later in today's webinar, I'll be giving you a preview of the 2020 training plan.
Hi, everybody. This is Sarah Bell, and I am a Limeade Employee Experience Specialist. I work here at the Healthcare Authority supporting PEBB organizations with health promotion consulting.
Hi, I'm Jenny Holcomb. I'm a Program Coordinator with Washington Wellness.
Hi, my name is Ron Kemp. I support the public employers build and grow their wellness programs, and I help lead the Washington Wellness communications.
Good afternoon. I'm Aaron Huff. I also work with all the state agency wellness coordinators, helping them with their worksite wellness programs.
All right. Thank you, everybody. Thanks, Aaron. So as you've heard probably a couple names and voices that you may not be familiar with. We actually have 3 new folks that are helping us with our Washington Wellness Program. So Heidi Helsley, who I mentioned, Sarah Bell, as well as Jenny Holcomb, who is our most recent hire. And so we've been growing, and we're very glad that we have the extra support that we do. So let me speak a little bit more about that. So just to start from the top, I want to give a little bit of background on what Washington Wellness is so that we orient ourselves from the high level on down to the detailed level. So Healthcare Authority is the agency where we work and is committed to whole person care, integrating physical health and behavioral health services for better results and healthier residents. HCA purchases healthcare for more than 2 million Washington state residents through Apple Health, otherwise known as Medicaid, the Public Employees Benefits Program, which you are all part of, and beginning in 2020, and actually beginning this fall, the School Employees Benefits Board program. So HCA is the largest healthcare purchaser in the state of Washington. So it's moved down there from the Healthcare Authority. There's two major programs that we serve. The first is the Public Employees Benefits Board program, or PEBB program, which purchases and coordinates insurance benefits for eligible public employees and retirees. And PEBB offers high-quality benefits to more than 300,000 PEBB program members. So that includes subscribers, spouses, state-registered domestic partners, as well as children and other dependents. The PEBB board is separate and independent from the School Employees Benefits Board program. And also, the sister program now to PEBB that I mentioned earlier is starting January 1st, the School Employees Benefits Board program, or SEB program, will administer health insurance and other benefits to all employees in school districts, charter schools, and union represented employees of educational service districts in Washington state. So the School Employees Benefits Board studies, designs, and approves comprehensive, cost-effective insurance benefit plans for school employees and establishes eligibility criteria for participation in these plans. The SEB board is separate and independent from the PEBB board. And so just want to mention this at a high level, that we are doubling the population that we serve, beginning actually now during open enrollment for SEB and into the new year. So this changes the dynamic a bit, but we've got a lot of new help, and we're, luckily for us, a lot of the things that we're going to be talking about today, there's a lot of crossover. But I just wanted you all in PEBB land to understand and just be cognizant of the changes here at Washington Wellness. But we are dedicated to continuing to serve everybody as we have in the past. And finally, Washington Wellness supports organizations participating in both the PEBB program as well as the SEB program. And as I said, there's currently about 300,000 members covered under PEBB, and we anticipate there will be another 300,000 members covered under SEB program benefits come January 2020. So as I mentioned, they're in the midst of open enrollment right now. Okay, so a little bit about Washington Wellness. You may have seen this slide before. So we offer, we intend to offer easy, engaging, and ready-to-use resources promoting wellness programs that are included in the benefits program that PEBB provides. And so we have our main goal, which is to build, grow, and sustain effective worksite wellness programs to maximize individual as well as organizational health and well-being. So you may have heard us talk about the value proposition, why worksite well-being. And really, when it comes down to it, it's about supporting individuals so that they can be the best they can be as a person, as an employee, as a husband or wife, a father or mother, or what have you, as a partner, as well as really be to show up for work and help make work part of a fulfilling life, as well as be a productive member of that organization. And so that's our lofty goal. And the way that we support that is through a number of strategies. So we look at a lot of data to characterize the population that we serve. So we look at the PEBB population as far as utilization of programs, overall, who's enrolled, things like that. We also develop, implement, and monitor evidence-based population-focused approaches. So that's kind of jargony, but what that's really speaking to is the Smart Health program. And that's really something that is a tool that that we are able to scale up for all the soon-to-be probably 300,000 employees that are going to be eligible for the Smart Health program, roughly doubling what we did for PEBB. And so it's really one solution that can be tailored to the individual based on that well-being assessment that we'll talk about more later. Develop worksite wellness capacity. So that's, we have dedicated staff that focus on agency, higher ed, political subgroups, as well as SEB organizations now, whether that's sort of through face-to-face phone calls or via webinar assistance. We intend to build capacity so that you're as successful as you can be. And then we also engage the target population. We send out emails from here if people are on our email lists. We have promotions for Smart Health, things like that. But to a large degree, we rely on the organizations that we serve to be our partners in promoting all the things worksite wellness related. And then, of course, we try and model good wellness behavior, which is maintain and improve Washington wellness operations. And that includes us talking about what well-being means for us as a program as well as individually. And so even during our staff meetings that we had today, we regularly do icebreakers and things like that really get us into the why are we doing this work to begin with, to make sure that it's meaningful. So the point there is that we try and practice what we talk about. Okay, so a little bit more background, getting a little bit closer down to the sort of medium level here is really well-being. And oftentimes, we have interchangeably used well-being and wellness, but I wanted to start with this key phrase of well-being and define it. So what is it? So there's many ways to define it. I've seen many, many different definitions of this, but my favorite is living with purpose and feeling good. So what does that mean? So my example for me would be my purpose is to be the best dad for my 5-year-old who just started kindergarten. It makes me feel really good to fulfill this purpose in my life. So this is, she's just really, really important to me, and whenever I can do whatever I can for her, I feel it. I feel that emotion, and it's positive. And so the idea is that you connect with your purpose. Hopefully you're feeling good about that. And then the idea is possibly using tools like Smart Health to help you keep that health and keep you healthy and balanced as much as possible, so that you can be your best for yourself or whatever your purpose, or your child, or whatever your purpose might be. So it essentially means that you know your life's purpose, you engage in that conversation with yourself, maybe with your coworkers, with your partner, with your friends, and that you actively support it, and that it makes you feel good. So I oftentimes will be in a meeting and I'll ask people to raise their hands, who likes feeling better than worse, and most people raise their hands, and then who likes feeling worse than better, and hardly anybody, if anybody, ever raised their hands. And really what it comes down to at its most basic level is just that, is like feeling good around something that's really noble and really aspiring, which is that purpose in life. But to drill down a little bit further about why does well-being matter at work, I'm going to let Ron Kim take it from here. Go ahead, Ron.
All right, thanks, Justin. So what you're looking at here, this is on our Work with Washington Wellness card. And I just want you to know, for any of you who need additional data or research to try to sell or share, I should say, the value of well-being at work to your leadership and others, feel free to reach out to us. We'll definitely connect you with some information if needed. But this is just a great way to summarize it. So just starting in the upper left, the idea is this, is that when organizations invest in the well-being of their employees and of their work site, that leads to increased employee engagement, right? People are more excited, they're more into their work, they're in the flow. And when that happens, surprisingly, or maybe not surprisingly, you get better results, right? And those results, what that actually leads to, is not so much just that, well, this communication came out so much more clear. Really, it kind of boils down to the fact that employees have a better experience, right? Your talent not only walks in, but you get to retain them and keep them there. And while they're there, they're more productive, right? And so this is, I think, really helpful. It's going to speak to a lot of your leadership. So as you continue to try to gain that support, this might be a helpful way to quickly summarize and share it. So really quickly, I just want to explain why you should spend time working with us. For those of you who have in the past, this might not be new to you, but there's others of you who, you just started with us, right? And first and foremost, I want to emphasize the fact that wellness matters. And I know for some people, the term wellness just might not be a good fit. So whether you want to substitute that term with something like employees matter, or our work matters, whatever's going to speak and resonate with your audience, with your staff, think of that term, and it definitely applies here, right? Because it's all interconnected. On top of that, when you work with us, there's no cost to it, right? It's included with your PEBB benefits package, right? So if you reach out to Pam or Aaron, 3 times or 30 times, right? There's no extra cost to your organization. We're here to help you out. And in the end, we're here to help you out because of the work that we're involved with, it truly is a win-win for both the organization and for the staff. And we'll get into that a little bit more. Now, you definitely play an important role in all of this. Justin mentioned it, that we definitely rely on your help to help spread the word, right? Engage your staff, involve your leadership. And so a quick way to think about it, the 3 C's, is you're going to collaborate with us, right? You're going to communicate to your staff and to your leaders, and then you're going to coordinate your wellness program, okay? You're going to coordinate your wellness program. So a lot of you, I realize that, this isn't your full-time job, and maybe you don't have a ton of time to work with us. And if that's the case, if you do this right here, this is huge. Don't feel like that's not enough or, this is huge if you do this right here working with us. But for those of you who have more time, who want to take this a step further or have been doing this for a while, we have a tool in place to support you with that work. We call it the Smart Health Worksite Wellness Roadmap. Basically, it's our 8 steps to build and grow a sustainable wellness program. This is a quick visual of the 8 steps. I'm actually going to give you a demo of it in just a minute. I just want you to know that this is here to support your work, and you don't have to start this from scratch, okay? So 3 quick reasons why you should use the roadmap. We feel like it's an easy-to-use project plan. Some of you may work with projects quite a lot. Some of you, maybe not that much. In either case, this can definitely give you the framework to do this year after year, okay? And I really want you to think of it as a step-by-step checklist. It's not perfectly linear, but we did our best to literally walk you through each step, right, to help you along the way to develop your program. And for completing and submitting the roadmap each year, it actually gives us a great opportunity to recognize your work through our annual ZO8 award. And so by submitting the roadmap, you're actually submitting your application for that award. And so doing the Smart Health Worksite Wellness Roadmap, it leads to what some people call a results-driven wellness plan. And as I mentioned, a lot of you, maybe don't have the time. Promoting smart health, helping kind of get employees in front of a wellness benefit, that's what your time allows. That's fantastic, and that's great. To take it a step further, to be able to measure what you've done each year, this is what this is getting to. Some of the key facets that kind of weaved into our plan. One that I think is huge and critical is to align it with something that already exists in your organization, right? You don't have to reinvent a goal. Find something that's already there that's going to align with your wellness efforts. Policies, such a big part of it because this is what makes it real at the work site, right? There have been tons of policies in place over the years that maybe many of us might not even realize or consider as a wellness policy. Maybe something like, some of you might have heard of it, like a tobacco-free campus or infants at the workplace, right? Yeah, these concepts might have started with the wellness team, but because the value was, obvious and important to organizations, it went further than that, right? It just became something we do on like a statewide level. So where you go and find resources and learn all about the Smart Health Worksite Wellness Roadmap, I included the link down here. The webpage is actually titled Build a Wellness Program. I just want to emphasize these 3 points about it. First is that this is going to help you regardless of whether you're a new or a mature wellness program. We didn't just invent this on our own. We learned from a lot of wellness leaders and pulled from those best practices and customized it specifically for the folks that we support. And when you use this roadmap and try to submit it each year, which I hope you do, I just want to emphasize that it's not an all or nothing application criteria because we recognize and respect that you're all starting from a different place, right? You have different experience level with it. You might have different levels of budget support, leadership support. So we take all that into consideration. And, why try for the Zoe Award, right? Now, I'll just tell you up front, we don't give you a ton of money for doing this, right? We don't quadruple your wellness budget or something like that. But I think there's a lot of value in it. I think the main value is the fact that it really helps you build awareness at your organization about all the great work that you're doing, right? And it's a nice way to recognize not only your efforts, but your team as well, and you all get to share it together, okay? So really think of it like that, a lot of intrinsic rewards into going for the Zoe. And I think it looks really well for your organization as well. All right, so that's all talking about it in theory. Let's just dive in and let's take a look at it, see what we have to offer. Okay, so, sorry for the quick scroll there, but this is the webpage, how to build a wellness program, all right? And this is really where you want to go to access any sort of examples, templates, or resources to help you complete the roadmap. And where you're going to find all of this, I'm going to scroll down, and it's in this section here. That's the header is titled Resources to Complete the Roadmap. And we have examples, ideas, articles for each single step, right? We have them all laid out. Some people call this an accordion. When you open up a step, it's going to give you a little bit of background and context, what this is, why it's important, and then finally, how to get there. And so an example I want to show you is actually under step 4, make a plan. So within make a plan, on this part that says, how do I create a wellness plan? We have something here called wellness plan tips, all right? So let's envision that, you don't work with project plans that much. You're starting from scratch. What do I do? I would highly recommend take a look at this document. It's going to give you tips in terms of, well, how do I create a mission for my, wellness program project plan? How would I start figuring out what our goals and objectives are? And we give you some ideas and shortcuts right here that I think are going to be not only very easy to get going, but also very impactful and will get you to that results-driven area that we want to journey towards, right? We want it to be results-driven because that's what speaks to leaders. That's what definitely speaks to leaders, all right? It's a short 2-page document, doesn't take too much time, lots of ideas just to help you get started. Another section that I think people might be a little bit scared of and not really know where to start is under step 6, create policies, right? So what I want you to know is through the work of your colleagues who have submitted the roadmap over the past years, we have examples for you, right, that you can build off of and use as a great starting point. So let's take a look at what these examples look like, right? So I'll just call out, and believe me, we got way more examples from groups, and if something here doesn't meet what you're looking for, reach out to us and we can probably find the right fit. But without including everything, this is 13 pages long. We have examples from Spokane Regional Health District, Washington State Patrol, and Washington Technology Solutions, right? And literally as you go through these, let's just jump to this one on State Patrol. Here it goes. They have something about, well, this is what our policy is about our wellness program. And, for somebody who, wouldn't know where to go or what to include, this hopefully gives you a great starting point, right? You don't have to think of it all on your own. There's other people doing this work that are happy enough to share it for all of us, okay? Okay, so just remember, when you need information in terms of how to do something, how to complete a step, this is where you go, resources to complete the roadmap. What I'm going to take you to next is right here. This is the link to the actual roadmap tool, which is basically, I'll just call it a fillable online spreadsheet, right? That's really what it is. It's really just a checklist to help you and your team stay on track. I highly recommend that it could be a great tool to use to run a wellness meeting, right? Would be a great tool to use to run your wellness meeting. So I know I'm talking about it. Let's just take a look at it, right? So if you click that link, this is what it takes you to. If you're a new user, you just click Get Started. You'll fill out some information. It sends it off to us, and then we'll reach back out to you once we figure out how to get you set up, okay? But I got an account here that I'll show you. I'll log on and let you see what we're looking at. So there's information in here, there's instructions on how to get going, but this is basically the gist of it, right? I'll just start from step one. Click View Profile to tell us about your organization. And the way to think about this is the deadline for this is February 28th of every year, right? So your next deadline is February 28th, 2020. And we're always asking you to share the great work you did for the previous calendar year, right? So in this case, it's 2019. I'll just highlight it there, 2019. So since this is the year I'm working on, I would want to click View Profile. This is actually a test account that you'll see. They have something for 2018 and 2017. And what that allows you to do is you can actually look back and see, well, what did we submit in 2018? How do we answer these questions in terms of our profile? All right, so click on View Profile here. And it's real simple, 5 questions, multiple choice, just to give our team a better sense of where you're at, right? Budget, whether you're in a volunteer or paid position, how many different work sites are you serving, are you doing this alone, and so forth. You put in your answers and you save it. It's that easy, right? That gives us a really good snapshot of where you're at. And then what you're going to want to do is go to this next section here, which, let me back up for a second. Right here, step number 2, click Edit to report progress for each step. And what that is the 8 steps here, right? So let's just start from step 1, get leadership support. And as I mentioned, this is basically just a fillable form, right? And so for each task within each step, you're going to tell us how things are going. Either you completed this, it's not completed, it's in progress, or for some of you smaller organizations, some of these, it might just not apply. And that's very specific to some of the access to the Smart Health Data Dashboard. So really, it's for the majority of this, you're either going to choose completed, not completed, or in progress. And again, I want to emphasize, there's no wrong answer, okay? Just as I mentioned up here in the directions, selecting not completed or in progress will not disqualify your organization from earning our award. In fact, I really want you to think about this as you're not so much telling us, right, for our own benefit, it's also for your team's benefit, right? Because as you look back on this, or as you start planning for the next year, it would be helpful to have a better sense of, did we actually get this done? Or, you know what, we never were able to finish this task. Maybe we need to spend more time this year figuring this out, right? And so as I mentioned briefly, this could be a really great way to run a portion of your wellness committee meetings, because you can go through these steps and figure out, what have we completed? What do we still need to do? And guess what? If you have a team in place, you can divvy up those tasks and find people who are interested in helping out, you know, in an area they like or that they're strong in, right? That they're strong in. So you go through that, and you have to answer something for every single task of every single step. You'll do that. And then you get to this next section here, which is a really important piece, which is uploading files. And the first main file that we ask you to share is your wellness plan. Again, this is not so much for our team's sole benefit. We really want your group to organize and keep track of your work. And what better way than to have a plan in place with examples of some of the key pieces that you did over the course of a year, right? So how did you, promote smart health? How did you involve your leadership? Do you have wellness policies? If you do, you should organize them and keep them together so you know where to reference them and you can build from them there. So again, yes, we get a great picture of what you've done, but also this is going to be very helpful for your entire team. And just get in the habit of organizing your work. And so you're going to share that with us. We ask you to try to do it in a single uploaded file. If you need help with that, feel free to reach out. And then finally, we we just ask you to provide some information about your organization just to make sure if you are awarded with the ZO8 that we get all of your team members' names correctly on the certificate, that we get the right name on the physical award. And so you just upload a separate file. Something as simple as an Excel spreadsheet probably would do the trick for this. And so there's more information down here. You actually, this submit button, if you see it's kind of grayed out, this won't come live until you actually do all of these things. And that's answer the view profile questions, select the task status for each task of each step. You got to select something, and then you need to upload those files. And if you do that, the submit button comes live, you click it, and then off you go. So within the tool here, this part is pretty quick. I would say for those of you who feel comfortable loading files and filling out a form, you could probably do this in like 10 minutes. What's going to take a lot of your time is, developing that plan, right? And then again, going through these tips and resources to figure out how to complete each of these steps, right? Because answering them is easy, but doing them takes a little bit more time. So if you have any more questions about the roadmap, I encourage you to reach out to our team. Each of us will be happy to help you and support you. Our goal is to get all of our organizations utilizing this, because this is what's going to take us from, just sharing and creating awareness to capturing results, right? Capturing results. And the great part about this roadmap is that it's not so much measuring your results in terms of how many people did I get to show up to the lunch and learn, or how many people did I get enrolled in Smart Health this year. Those are great pieces of data to capture and to reflect on, but really, this is actually doing a much better job of recognizing all the operational work that you put into place, right? Everything you do behind the scenes. And this is something that you can measure every single year, and I believe is a much better reflection of your body of work, right? Did you go through each of these steps? And if so, wow, that's a ton of things you got done in the year, and that should definitely be celebrated, okay? See if I can bring this back up for us. Okay, so that was a quick demo of the roadmap. Now, let's talk about Smart Health, right? One of our key resources for you to utilize. Some of you know a lot about Smart Health, some of you not that much. So let's start from the beginning. Why Smart Health? Again, there's no cost to this. It's included in your PEBB benefits. So for those of you who don't have a wellness program budget, yeah, Smart Health offers wellness incentives each year. So you're able to offer these extrinsic rewards to your staff with or without one, right? With or without a budget. Oh, okay, let me see here. See the display settings. Let me try to duplicate the slideshow. Okay, sorry about that, folks. Here, maybe this is the full screen version, okay? So, yeah, and Smart Health, guess what? Not only does it help employees, but it helps organizations. And I'll get into those details in just a second, okay? So first, let's talk about how Smart Health helps employees. We have annual wellness incentives. And really, it's there to help your employees be their best, right? It's really there to help them be their best. So let's start with the wellness incentives. Yeah, every single year, there's an opportunity to qualify for a $25 Amazon.com gift card and a $125 wellness incentive. You can learn more all about this. I'll share the link where you can go find the details. And these are great, right? This can help get people's attention. But to me, what the most valuable incentive is, connected to Smart Health, are those intrinsic rewards. And Justin touched on this earlier. Purpose is a big thing that we talk about within Smart Health. Actually, within for 2020, the theme that we're going to kind of bring back is going to be, what's your why, right? So your why is your purpose. It's what's most important to you. And it's helping your staff focus on that. What is most important to you? And whatever that is, that's why you're going to put in effort to take care of yourself, right? Because without you taking care of yourself, you really don't have the energy to give your best and take care of others the way that you would want. And so when I'm out explaining to people what is smart health and they've never heard of it before, I try to tell them to think of it as their own free personal assistant. So it's really cool. You know, there's an app, it works on any mobile device, and it can support each of us anytime, anywhere we're at. And so this is how it could work. Let's say that I'm a little motivated, I'm feeling like I want to try something new, right? I want to do something to feel a little bit better. I could do some research online. I could do that. I could go to the library and check out a number of books, right? I could do that too. I could even go to maybe a class and sign up for some sort of activity to get involved. Now, all three of those are great routes to take. They are. As an alternative, one that would be really quick and easy is just simply logging into Smart Health and taking a look at the ideas it has to offer right there and then. And surprisingly enough, you may run across something that piques your interest. And if it does, all you have to do is click on it, join it, see what it asks you to do, and then track it and follow along. I mean, that's really what it is. It gives you some of these ideas. It gives a great library that it rotates through all year long to help us be our best. And it really focuses on 4 specific areas that's really about whole person well-being, right? Whole person well-being. All right, how Smart Health helps organizations. A lot of you probably know how it helps employees directly, but some of you may not realize how much power there is to Smart Health in terms of how it can help the organization. I think one key area to think about is how much employees value their benefits package, right? There's a ton of research that's come out that talks about, you know, salary is not enough, right? That's not the main reason people stay in a job. And so the benefits that you offer them, that's huge. There's a lot of value, and Smart Health is a really big piece of it, right? Because it's a big piece of the PEBB benefits package. It really helps empower the employee, helps them be their best, and it shows them basically that you care, okay? Through Smart Health, the more you promote it, the more you get people in the door using it, you're going to get access, easy access to meaningful data, and a custom annual report that's going to provide you insight that I feel like you're just not going to be able to get anywhere else. So we talked about your important role in terms of just working with us. Here's how you can help promote Smart Health. First is try Smart Health yourself, right? That's the best way to find out what it's about. Try it yourself. Then take advantage and use our resources that we have there for you. I'm going to share a few of them for you later on, but we have a lot of pieces in place, so you don't have to go and create a bunch of things on your own. You're more than welcome to, but we have a ton of pieces in place. And then finally, it's helping and supporting your staff. Not so much that you have to remember all the details or be a technical wizard about Smart Health, but it's just realizing that there's a dedicated Smart Health customer service and helping, you know, just remembering where to point staff to for that. And then also just kind of realizing, hey, we have a lot of resources and information that can keep you informed of what's new, what's changing, so on and so forth. And so the ready-to-use resources, we have things like messages, flyers, video, and more, all of these in place to make it easier for you to promote Smart Health. Okay, and so this is the key thing to focus on, is where you're going to find it, right? So the first web address I have there for you, this is where you and your wellness committee want to go. That's where you're going to find resources to promote Smart Health. And the web page is titled Smart Health for PEBB, okay? But when employees have questions about Smart Health, or even yourself as an employee, when you have questions such as, well, how do I qualify? Or what is the deadline? You're going to go to the second link, right? And it's titled Smart Health parentheses PEBB. Okay, Smart Health parentheses PEBB. Yeah, the names are very similar, so you're going to want to pay attention to those URLs. But basically, one's to support your staff, and one's to support your wellness team. Okay, so very different in terms of what content is there. All right, meaningful data and reports. Let's get into this part here. Some of you are familiar with our real-time data dashboard. For those of you who aren't, this is a lot of insight in terms of who's using Smart Health, where are they at, what do people like. And so this is a summary of what you can get in a really quick snapshot that can be very informative and insightful to your wellness program. An easy example of this is you can quickly gain a sense of what activities people are joining within Smart Health, right? That would tell me, wow, so if that's what they like, maybe we should focus on that, right? Maybe we should create a campaign around one of these things that are popular. And at the same time, it also even tells you, well, what activities are drawing a lot of comments from your staff, right? So what are people vocal about? What are people excited to talk about and share? That might be a great opportunity for something like a lunch and learn or some sort of learning opportunity that's shared amongst the staff, right? And again, the important thing to stress is no individual data, all aggregate information based on your organization. So that's the Smart Health Data Dashboard. There's actually something that's a custom annual report that is based on all of your employees who complete the well-being assessment each year. Now, this is just a small snip of a table within that report, but I'm showing you this because I want to highlight some of these metrics on the next slide for you, which I feel like it's very powerful and it's going to be very hard to get anywhere else. And I feel like this is going to be great information that's going to speak to your leadership. So within that report, there are areas that focus on the overall productivity dimensions, is how it's titled. And so some of those metrics are things like job satisfaction, belief in company, fit with culture, right? I know that for a lot of state agencies, there's the annual employee engagement survey, and that's nice to have, right? That's nice to have. This one, I feel like, goes even deeper than that. That's just my opinion. It goes even deeper than that. To get this sort of information, I mean, thinking about how would I find this out from our workforce, right? Like, how, as a leader, how would I find out this information? I mean, you'd have to hire a consulting firm. They'd have to come in and do all these interviews, maybe some focus groups, then come back like a year later, do it again, and then get like a year-over-year comparison, and then roll it all up and then provide it in a report. This is available to you within just a click of a few buttons. But this report only becomes more powerful as you get more people completing that well-being assessment each year. So if you never knew, like, well, why should I report about this or why should I promote it? This might be a big reason why, right? To get access to this kind of insightful information. So that's how it can help the organization. And on top of that, it also covers well-being dimensions that really speaks to and talks about how are my staff feeling? Like, how can we support them so they can continue doing great work? And it has dimensions such as their energy level, or how are they dealing with stress and anxiety, right? These are tough things to find out on your own, right? It would be, I think, a little bit more delicate for the organization to ask each employee directly these types of questions. But through Smart Health, being a third party, I think it makes it a little bit cleaner where you're removed from that, right? You're removed from that. All right, so that's a lot of background in terms of why Smart Health can help your employees and help your organization. I'm going to hand it over to my colleague, Aaron Huff, who's going to tell you about Smart Health for 2020.
Okay, great. Thank you, Ron. So just before we get into the Smart Health for 2020, since you guys have had a little chance to hear about kind of the value of Smart Health, and also more importantly, the value of the roadmap that Ron just went over, which really will help you with your worksite wellness program, and also, you know, as a way to potentially earn our Zoe Award, I would strongly encourage you guys to look at the roadmap and to go through that, because it does really help you develop and build your worksite wellness program. And the roadmap, in terms of the completion of it, everything is going to be due, you know, around the first quarter or so of next year. So it's not too late to get in there and to get started on it. So please feel free to do that and reach out to any of us for any assistance in helping you through that process. And so just a little bit about some upcoming events for 2020 that I'd like to share with you. The first one is going to be the $125 wellness incentive deadline. So previously the deadline was the end of September, and so now we're actually moving that deadline to the end of November. So that's actually, September to November, which is 2 months longer than the previous years. And then in addition to that, medical waive employees for Smart Health Portal only access. So employees that have waived medical coverage will now have portal access only to Smart Health. So that was one of the things that we have heard a lot from people is, hey, I've waived medical, but I still want to be able to participate in Smart Health. And previously, they weren't able to do that. Starting in 2020, now they will have access to be able to do that. So a couple of exciting things happening that hopefully makes this a little bit easier and gets more people involved in the program. So some upcoming things that you're going to see on Smart Health that we're kind of excited about is our statewide assessment challenge, and this is really where when you log into Smart Health into January, you take your well-being assessment. And most of you guys know it takes around 15 to 20 minutes or so, and there's a bunch of different questions that you have to answer. And really, it's designed to try to help you understand areas of your life that are important to you, and also areas that you could use a little bit of support in. And so why we're choosing to do this as a big promotion is that really the well-being assessment is foundational to Smart Health. It also powers machine learning and makes recommendations based on how you answer your assessment. And then it also raises awareness to areas in your life where you have some strengths, and also helps you understand areas where perhaps maybe you could use a little bit of improvement. And then lastly, you have the ability to track year-over-year improvements in areas that matter to you. And also you're able to see how you're, based on the different dimensions within the program, how you compare to the rest of the Smart Health population. So it really is the core and the foundational component to Smart Health in terms of the activities that it recommends to you. So just a little bit about how this assessment challenge is going to work. The tile is going to be live starting January 3rd of 2020, and then it concludes on February 29th. And organizations are going to compete against other organizations in the state. And what that looks like is all the state agencies, you guys are all going to be competing against each other. For the higher education folks who are with us today, you guys are also will be competing against each other, all the other higher ed orgs. And for our public employer groups who are with us today, you guys will also be competing against other public employer groups statewide. And so out of your respective group, there's two different ways that you can win. You can either have the highest well-being assessment completion percentage, or you can have the highest number of well-being completion. So some of the things that we're going to be able to provide to you guys to help you promote this program so that your organization can be the winning organization. We'll have a launch email kicking off the event. We're also going to have in-tile custom leaderboard updates. And this will look a little bit differently than what you may be used to in the past, is that when you have your tiles, there's a leaderboard that you'll be able to see. It's a special little tab on the right-hand side of the tile. This particular leaderboard will actually be within the description of the tile, so you can just simply go back to to complete the statewide assessment challenge tile, and then periodically look in the description, and we'll have a custom leaderboard that'll be put in there that'll show the top 5 organizations in each of those, in terms of the well-being assessment completion percentage and the numbers. And then we're going to continue to have ongoing promotional messaging. So look for some messaging coming out from Limeade about the Smart Health Assessment Challenge. And then we'll provide you guys with our Wellness Coordinator Toolkit, which will contain email messages that you'll be able to just simply put into your Outlook folder and send that out to your staff. We'll have flyers for you to be able to print off, posters. I think we'll have probably a couple different size posters, and then we'll also have digital monitor slides, which are used for those organizations that have TV screens in their building, you'll be able to take the content and put that directly onto your screen. So we're really excited about the statewide assessment challenge, and hope you guys are too, and can get on board and helping your organization be one of the winners. Another couple promotions and events to look forward to in 2020 is that some of you have heard about the leader walks that we have done. We'll be promoting this more on a statewide effort, and kind of what this looks like is where you walk with your organizational leader, and there are you other organizations that are near you. You guys can put together some, like a collaborative event where like 3 or 4 different organizations all go walking together with your leader, and it doesn't have to be for very long. It can just be for 10, 15, 20 minutes. But the idea is to, try to get out and walk with a leader. So look for more updates in terms of what that looks like, and as we approach into 2020. And then also later on in the year, we'll be promoting a statewide charitable giving campaign, which is going to be probably a lot working with a combined fund drive. So look for more details on those to come, and hope you guys are excited about those as we are as well. Okay, so next I'm going to pass it over to Ron to go over some of the Smart Health resource demos.
Yeah, thanks, Aaron. So we're just going to go back to one of those websites that I referenced for you before. And let's just go take a look at some of these that we have ready for you, along with other resources to help you and your committee start planning for 2020, right? So we have some of this. Let me get you here. And here's the page here, Smart Health for PEBB. I know there's a lot of content on here, but believe me, all of it is relevant for you and your group. Just got to find some time to go through this. A key section that I want to emphasize is this part here, how do I promote, right? So if I click on this, some people call it a jump link. This is where you'll find our ready-to-use resources. And some of these you might be familiar with, but others are brand new for 2020. And so I'm going to go to this section here called Events. So statewide assessment challenge, which Aaron just talked about. We got 1, 2, 3, 4, 5, 6 different ready-to-use resources for you to put into action. And I got one queued up for you to take a look at. It's the flyer. And so here it goes. This is a picture of it. And we got a lot of great feedback from some of our wellness coordinators. So we have it structured a little bit differently than before, but we have the date range of the activity on here, as you can see, how many points it's worth on Smart Health. Here's a little bit of information about why this is important. We wrote, help your organization rise to the top by completing your well-being assessments. And then this is a little different down below. We used to, promote the Smart Health app separately. Now we've just kind of weaved it into some of these resources. So there's a call out down here that says prefer mobile, download the Limeade app. It's called the Limeade app, not Smart Health app, and enter the code Smart Health. So that should make it easier for your staff and you to let people know. It's like, oh yeah, there's an app for that as well. So this is an example of just one of them. And I think we're doing pretty good on time. So why don't we go ahead and open another one? I think Aaron did mention about the monitor slide. So why don't we go ahead and open this one up? And we have it chunked out into 3 slides. If you're only allowed to use, let's say, 2 slides, I would highly recommend going with the first and the third. So here goes. It's just loading up. It's going to have a similar look and feel, right? So this is the opening monitor slide page. There's the name of the event, has Smart Health, the date range. Page 2 goes more into that short description about the activity. So keeping it pretty simple, right? People are looking at this on a monitor. The slides change like every few seconds, so not too much content to sift through. And then the third slide, if you're only allowed to keep 2, includes our logo, the URL, and that call out about, again, people who prefer an app. Okay? So we have these resources ready along with a message. This should make it really easy for you. In the past, for the kickoff of the year, we actually kind of had multiple things going. For 2020, we're focusing on this statewide assessment challenge, and we're hoping all of you get on board and promote this, and it kind of makes it easy to kick off the new year, get people started with Smart Health, and then off we go, and then hopefully have a great 2020. Okay. This one. All right, so what else do we have on this page? Well, if I go back up to this, how do I promote section here, there's mention about a turnkey toolkit. We do have toolkit activities already listed out for you for 2020. So let's go to that section. We actually have the toolkit still going for 2019. You'll see them here. October's just about to end, but we even have some for the winter months. So take a look at those if you're still trying to promote Smart Health, still trying to get people involved. So there's those for you. But for 2020, these are the list of activities that we are going to create resources for you. We're starting with the statewide assessment challenge. Then we go to our theme, which is what's your why, and we'll take a look at one of those. And it goes so on and so forth. There's one about sleep, successful habits, those two other key events, the leader walks and the statewide charitable giving. And then finally, winter workout, because, you know, it's tough to be active during those winter months. So let's take a look at a different type of resource for what's your why. As you start looking at this, you might notice that, yeah, we have a flyer, poster, monitor slides, handout, table tent for each of these. That's our plan to create. And so for this one I want to display to you, this is called the handout. And so what's your why? Your why is your purpose. What is most important to you? And then on the second page of this handout, it's going to give you a little bit more description about your why. Again, have that URL and that call out about the app, okay? So more to come. We'll be adding these resources for track your sleep and so on shortly. That's the plan. To also help you in 2020, we have what's called the activity tile library. Some of you may know about this. Some of you may not. You might not even realize we actually had one for 2019. And so what this gives you a snapshot of is every single Smart Health or I should say almost every Smart Health activity that your staff and you would see within the platform the entire year. So I have it ready and queued up here for you. And so this is the library for 2020. There's a table of contents to help you kind of navigate through this. A little description and context about what this is, how you can use it, where you can find more resources. But just really quickly, I'm just going to focus in on one. Let's take a look at this annual activity that's going to be up all year. And here it is. It's called Join the Smart Health Community. It gives you the details here in terms of, you know, when it's on, how many points it's worth. And then on this other side here, gives you a little preview of the image and the content that each of us would see about this activity. And so the way to think about this is, you know, we have our turnkey toolkit. And if for some of you who say, well, I need to do more, I want to promote beyond just what you're offering within the toolkit, I would recommend coming into this activity tile library and having a chance to basically find something that fits your group, right? And when you find a fit, you can then create your own promotional material or collateral based off of the information and content here, right? That way it could be aligned, it could be consistent. So if you really feel like, let's see here, what's a good example? Let me go back up to the list because I know actually a lot of people are into promoting health observances, and we have them weaved in here as well. So you know what? Here it goes. I see one right here, American Heart Month. I'm just going to click on this. So let's say your group is big into American Heart Month. That's an annual thing you promote. I would recommend, okay, well, guess what? American Heart Month is on Smart Health. We're going to feature it from February 3rd through February 28th. It's worth 100 points. If you were to create a flyer that promoted American Heart Month and simply put on there somewhere, don't forget to get your Smart Health points for this, right? That could be one way to do it. If you wanted to really build your collateral around the content that's within Smart Health, that's where I would say you can go to this section here, the About This Activity or More Information, and you're more than welcome to borrow or literally just copy and paste anything you want from here, and basically use it for your own promotions, right? If you're going to create a message and you like the way it's framed here, you don't have to start from scratch. Just use what we have here. We include resource links and ideas that you can check out. If you like one of them, you're more than welcome to share it as if you thought of it yourself. This is what it's here for. It's really here to help your wellness program. It's not as if we want you to feel like, well, that's a Smart Health thing, so you really shouldn't be talking about it as if it's something that you created. When in fact, I would say that's exactly what we would want you to do. This is your wellness program, right? This is for your organization, this is for your staff. So we have that in place for 2020, it's up there. Hopefully this gives you and your team enough time to take a look, preview what's coming up, and start making some plans for the new year. All right, so that's what I have in terms of the Smart Health resources. Let me go back to this here. And is this displaying properly? No? Okay, thanks for the heads up. Let me go to this. Maybe this is working in full screen now? Yes. All right, great. So let me hand it actually back over to Aaron, who's going to share with you about the diabetes prevention program.
Okay, great. Thanks, Ron. So next I want to just talk to you briefly about our diabetes prevention program. Some of you have likely heard of the program already, and perhaps maybe some of you guys have not heard about the program. But nonetheless, it's a really great program and a benefit that is available to state employees. Really, the diabetes prevention program is our virtual program that's powered by OMADA. And as many of you may know, diabetes is a complex group of diseases all related to high blood sugar. In Washington, diabetes is the 7th leading cause of death, and thankfully, we have a program to help reduce the incidence of diabetes in our state. This particular diabetes program is an online behavioral program that's really designed to help at-risk individuals combat obesity-related chronic diseases. So participants in the program essentially kind of make modest health changes that lead to weight loss and reduce the risk of type 2 diabetes. So a little bit about why the DPP. So we know that 1 in 3 U.S. adults are currently residing with prediabetes. And in addition to that, just over 125,000 hospitalizations occur each year, in addition to the $6.7 billion in health and medical health related costs just here in Washington state. It is a proven success. The OMADA program is based off of the same curriculum as the National Diabetes Prevention Program and is recognized by CDC to reduce the risk of prediabetes. So that we know that if we can have a recognized program like this that's evidence-based and we can get people to participate in it and have them create these modest changes in their life, then we're going to also have improved healthcare. So some resources to help you promote the diabetes prevention program, very similar to some of the ones that we have already mentioned so far today. There is a video that's on our website in the same area that Ron was talking to you about for the resources. You can take that video and promote that to your staff. You can put it on your digital monitor slide. There's a lot of different things that could be done with the video, and it's a great way to show a quick overview of the program to kind of help employees understand the benefits of it and just really how neat the program is. We also have messages as well that you're able to use to promote the program. And in addition, we have flyers and other resources that we've discussed earlier today to help you with promoting the program as well. So just a little bit of statistics that we have seen so far about the program. Hopefully you guys can all see this, but if you take a look at the first line where it says your population, this really is the number of logins on a weekly basis which is based off of 20.4 compared to Omada's benchmark of 5.0. So our PEBB population, which has, and by the PEBB population, we're talking about those who participate in the Uniform Medical Plan. They're quite a bit higher in terms of the number of logins. And then we also have a higher completion rate of the lessons. There's quite a few different lessons that you go through as a participant. And the region's population, or the UMP population is a little bit higher. We're about the same when it comes to weigh-ins compared to the benchmark. One nice component about the program that you may or may not know is there's a food activity tracking component to it. And our population is a little bit higher in terms of the overall benchmark. And then messages to the coach, we're about 50% higher there as well. And then the group posts, which are things that go onto the discussion board, we're running at about the same as the benchmark. So the good news is that we're having a lot of high participation in the program, and we're also seeing a lot of successes with the program as well. In general, we have about an 85% satisfaction rate within the program, and this is based off of 400 responses that came in from the survey. And then in addition to that, just a couple other interesting tidbits of information. If you're interested in, how many people have really lost weight? Well, out of 1,655 people who have participated in the program, there's been a total of 11,631 pounds of weight loss. So I think that's pretty substantial and speaks a lot to the success of the program. So where do you find some other resources? So to help you, you can go to the diabetes prevention program or diabetes prevention page. There's a link for that. And then if you're looking for resources to support your staff, your wellness team, and others, then we also have a link below on our PEBB member page to help support you in that as well. So next, I'd like to hand it over to my colleague Pam, who will talk to you a little bit about some upcoming wellness coordinator training opportunities.
Thank you, Erin. So I'm excited today to give you a bit of a preview of what's coming for 2020 training. And I want to start off by sharing with you that we continued our planning for 2020 to ongoingly provide opportunities for wellness coordinators, wellness committee members, and supervisors and managers. And very much our intent or objective is to continually provide educational opportunities that's going to help build your knowledge and skills, as well as the resources you need to truly develop wellness programming, very specific to your needs and interests, that's going to increase employee well-being. So that's very much our intent and purpose with our planning and what we hope to bring to you in 2020. So what informs that for us? Well, it's very important for us to take in the input we receive from you wellness coordinators, supervisors, managers, and again, as well as wellness committee members, collaborating with you folks and your ongoing input through advisory groups, our advisory groups, and just ongoingly input as we meet with you throughout the year. And we also look at various assessment and data pieces, and those involve past event and training evaluations, as well as the annual statewide Smart Health Wellbeing Assessment Report. So again, together with various sources of data from evaluations, the statewide report, ongoing collaboration, we very much want to, again, provide you training that's going to really contribute to continuing to grow your workplace wellness. So I'm going to share with you from this training, just list the various formats that we will be providing the trainings in for 2020. We will continue with in-person trainings as well as live and archived webinars. And we will continue to, of course, visit you on site, Ron, Aaron, Heidi, and I. And of course, during those on-site visits, whatever additional training and support that you need, we will continue that, providing that. We also will be continuing to offer the e-learning module wellness training for supervisors and managers on the state learning management system. And just a reminder that this training is also available in alternative formats to those of you who do not have access to the learning management system. And in this presentation, on a slide that Ron shared with you, the roadmap steps, there is a link under step 1, getting leadership support, a link to the training on the learning management system. So you could take a preview and look a little closer at that. All right, so let's look at what we're planning overall. We're building off of the presentations we offered a couple of quarters this year. Continuing with that quarterly presentation theme, we will be offering a in-person training, and also you can join it live via webinar. We'll be providing 4 of those for each respective quarter. And with each presentation, we are hoping to bring to you an expert in that particular health topic area, as well as aligning a smart health tile for an opportunity for folks to earn points tied to the specific campaign tied to the topic. So let's look at those a little more closely. First quarter, we have a date and time and location already on our meeting and materials page for mental health in the workplace. There's been an ongoing and very growing interest in mental health in the workplace, various topics and focus coming from you folks overall. So we're going to fine-tune that particular focus and provide that training for you on February 26th from 10 a.m. to noon. And again, that will be held in person here at the Healthcare Authority. And again, of course, those of you that don't live in proximity can join via a live webinar at that date and time. Our second quarter focus will be tobacco cessation. We, of course, had earlier this year a live presentation for that topic. And as I'm sure all of you are aware, it continues to be a growing and very urgent health focus and topic. So we will have the tobacco folks from the Department of Health joining us again, providing updates. There's some new things happening tied to the laws around the selling of tobacco, various updates and input to get you feeling continually focused on increasing awareness and hopefully contributing to behavioral change for those that use tobacco. The third quarter topic, sleep, from the annual statewide well-being reports that we receive, and we started receiving those in 2015, and every year since, that's in the top 3 self-reported health concerns that employees are reporting as far as a health issue that they're struggling with. So we really want to zero in and focus on that topic and help promote and hopefully some resources to help employees with that. And then lastly, the fourth quarter, an update on diabetes prevention and again, its impact and how we can increase awareness and hopefully encourage those to tap into the wonderful wellness benefit we have with our diabetes prevention program. So a little bit more information tied to those quarterly presentations. With each quarterly presentation topic, you will receive a ready-to-use toolkit, and those will combine a combination of things, but primarily each one will provide a promotional campaign guidelines for you, all the steps and associated resources that you need to, develop and implement an awareness and possibly intervention campaign tied to that health issue. That will include ready-to-go email messages for employees, for again, promotional posters, flyers. And I've provided a link here to remind you that we will post, again, the logistical information tied to all of our trainings, date, time, location, etc., as well as other related promotional resources on the meetings and materials page. So I'm going to switch it up a bit here and share a wonderful opportunity that we're excited to offer to you folks. And this involves a program through Kaiser Permanente. They've asked us to pilot 5 of these programs, and what that simply means is, 5 organizations that are interested in testing this program, and then from that we can help, that will help inform and decide if we, want to continue to offer it to all organizations that we work with. And this program is an evidence-based program developed out of Stanford University. It's called Live Healthy, Work Healthy, and it's very much a chronic disease self-management program in focus overall. They're certified trainers for this program, and they have certified trainers in Washington now in the locations of Olympia area, Tacoma, Everett, and Seattle areas. And these are on-site. They're on-site 12 one-hour sessions over 6 weeks. And it's a group workshop format, 12 to 14 participants. And there's absolutely no cost for any employee, regardless of what health plan they have. So this will be available to all. And again, this is for those that are working towards, and managing their chronic disease issues. And so again, that's very much what the program is targeted to do, is to provide resources, support, and helping with making some small but very impactful changes that can help manage their chronic diseases. A little bit more about the program. Overall learning strategies, again, and very much a supportive environment that includes, developing a self-management plan. There's always brainstorming, problem solving, sharing successes, challenges, very much a group supportive effort in helping develop their own self-management plans. And different focuses that will be addressed will include increasing activity, eating better, managing their health issues, improving sleep, and managing time and stress. So I certainly welcome questions, again, at the end of our session today, about if you have more questions that you'd like to ask about this opportunity. But I am providing a link on the slide here that will take you directly to a great resource that gives a very comprehensive information on the program and all the details attached to that. However, if this really piques your interest today, we very much would like to hear from those of you that are interested in knowing more and possibly bringing the pilot to your organization. So if you could contact us at Well Wellness, at our Washington Wellness inbox, and let us know if you're interested, and then we'll get back to you and go from there. Again, as far as asking any additional questions that you may have, what it involves as far as bringing it to your organization, we'll connect you directly to Kaiser, and they'll work with you directly as far as, bringing that program to your employees at your organizations. So please let us know if you're interested. We'll be excited to follow up on that. And then the last thing I'm going to address today is the Healthy Worksite Summit. And for those of you that aren't familiar with the Healthy Worksite Summit, it is a Washington State conference that it's annual. It's opportunity to attend it yearly, and it's primarily hosted and brought to us through the Association of Washington Cities. And we play a participating role in that we serve as a sponsor. Washington Wellness serves as a sponsor. We also hold a couple of seats on the planning committee. And we also have an opportunity to bring offer a session to you wellness coordinators, again, your wellness committee members, supervisors, managers, all are welcome to attend our session each year. So why attend the Worksite Summit? Well, it's a wonderful opportunity to network with your peers and professionals in the field of worksite wellness programming. Just a great opportunity to make those types of connections. And again, hear from the experts. Some of the different sessions, for example, earlier this year that were offered, well, there was one called the Blue Zone Project in Creating a Culture of Wellness. There was an update for legal guidance for wellness programming, and another one, for example, incorporating mindfulness for an evolving workplace. Those are just 3 examples of many, many different topics, sessions, keynote speakers, experts, and again, national known people in the world of worksite wellness and program development. And of course, that all leads to continuing again to learn and build your skills. Our session this year, just to make one last note, our session, the Washington Wellness session, involved the topic of building a workplace through community. And we had a wonderful turnout, and I think we had over 140 folks join that session. We were delighted about that, and we're really looking forward again to bringing a session to you again for 2020. And Ron also had a session at the conference tied to communications, which was titled Easily Enhance Your Wellness Communications. So again, just a wonderful opportunity to build your knowledge, your skills, network, and just have a great time. So I'll share some of the details tied to that. It's generally and will continue to be in 2020 at the Linwood Convention Center. It's going to be held, it's a 2-day conference on March 18th and 19th. There are opportunities, you can register for 1 or 2-day options, and that starts in December. There was an early bird cost for the 2-day, the full conference this year, which was $250. And I don't have details for 2020, but I'm sure it will be if not the same, something very close to that. And of course, we'll keep you posted as we learn more. And again, over 400 attended this year, the conference. It's very well attended conference overall. And I believe it's been held for over 30 years. So it really has some staying power and has developed a top-notch reputation, again, in the area of worksite wellness. So if you want to learn more about that, I provided a link, direct link that you can check out about the Worksite Summit. Okay, a little bit more. We have been approved to offer 60 scholarships in 2020 for the summit. And of course, we never have enough to give away, So we're hoping, as we have in the past, for this year, for example, that those of you that have a budget that you can draw from to support you attending the conference, that will really be helpful, and us, having a nice representation of wellness coordinators and wellness committee members there for 2020. The scholarships covers the 2-day registration, and I'd like to share with you that it does not cover other expenses such as your lodging. Okay. So I think that wraps it up for what I want to share with you today. I'm going to hand it back over to Justin Hahn. He's going to share with you some opportunities for collaborating with us Washington Wellness folks.
All right, thanks, Pam. Thank you, everybody. We're nearing the end of our presentation here, so we're going to be asking, for your questions and attempt to answer the questions that you've already submitted through the chat box. So if you have some waiting, go ahead and start putting those in. So as Pam indicated, I want to talk a little bit about collaboration. We as Washington Wellness are available to provide all kinds of assistance to make your workplace wellness efforts thrive in some of the following ways. So around worksite wellness support, we have things like emails, webinars like today, phone calls, one-on-one or group calls, site visits, general technical assistance like around the roadmap and how to complete that, all kinds of things like that. Sometimes it feels like we have just a lot. But hopefully you feel like it's manageable and that you're able to find the things that are most meaningful to you with regards to that support. And then as far as workplace wellness resources, we also have all kinds of things that we put together that we hope are helpful with regards to communications, like flyers, posters, promotional items that you can hand out, like swag, Smart Health swag items. And also advisory groups. So we routinely get together via phone and through webinar to check in as a group, especially for agency and higher ed, have their own respective advisory work groups. And so I also wanted to mention, as a program manager, as we move forward in 2020, the reality of that we're going to be serving a lot more folks, and we feel like it's manageable, and we're going to have to pivot a little bit as far as the way that we approach this work. We're going to have to make our what we do a lot more scalable. And so, and also, I'd like to unleash the power of wellness of you all wellness coordinators, even more than we have in the past, hopefully. And that's really to draw upon the peer-to-peer assistance around planning, implementing, and evaluating. This is going to be ever more valuable as we approach the new year and the future. So we consistently hear wellness coordinator feedback that learning from each other is crucial to the success of your organization. Wellness efforts, and we want to help facilitate this as much as possible. So current examples, as I mentioned, are agency and higher ed advisory meetings, workplace, that virtual wellness coordinator network, which is it's Facebook for Work, that we invited folks to sign up for the Healthy Worksite Summit earlier this year. We also have the Healthy Worksite Summit, so that's a great place to learn from your peers and learn from professionals in the field, as well as the leadership walk, the governor's walk that we did this year. And so as we think about opportunities moving forward, I want to invite you to think about all the things I just mentioned, but also things like the Healthy Worksite Summit and participating with us in planning and the planning and the execution of the Washington Wellness session. So we have some general ideas about that right now that we're just starting to get into. So you'll likely, if you're interested in participating with us and helping us to plan and possibly lead some small sessions with your peers, please reach out to us through our Washington Wellness inbox email or email one of us directly, and we may be reaching out to you as well. Also, as Aaron mentioned, we're going to have a leadership walks this year. We're actually going to be broadening it for 2020 rather. We're going to be broadening that not just as the governor's walk or the this walk or that walk. The governor's walk has been a large one, but there's also been a really great example of a homegrown leadership walk in Tumwater, where this last year in 2019, 12 agencies participated and a couple hundred people got together in the park in Tumwater, if you're familiar with it, where they have the farmers market. They have a field there. They had a balloon toss, and it was just really cool to see all these wellness coordinators come together. And I could see the results of their planning and expertise and sharing together and really coming together to make it work. And because we're really stronger together. And so I want to continue to help facilitate that through getting meetings together, getting best practices, sharing best practices on the leadership walks, so that we can sort of sprout other leadership walks in other parts of the state, wherever they might be. So as I said, if you're interested in this, please let us know by through the Washington Wellness inbox, and I'll put that up on the screen here in a minute. And Yeah, I think that concludes this slide right here. So I'm going to move on to the question and answer part. So I'm going to ask my coworkers here if we've had any questions that have come in. I'm assuming there have been some questions. So let's check it out.
Yeah, we've had some great questions come in. Let me start from the beginning and make sure I catch any specific ones. It looks like the first one. Oh, this is a great question. It comes in. The question is, can you make the images used for the actual Smart Health tiles available so we can promote activities with consistent messaging? The most time-consuming thing in promotion is finding suitable, royalty-free images to use. We can't copy and paste the images and expect them to work on a building monitor or poster with decent resolution. So here's the thing, is that, yeah, that sounds like a great tip. We have that activity tile library available to you as kind of like a reference or resource, but we don't unfortunately have access to all the images within the library. There's quite a few Smart Health tiles in there. What we do have available to you are those turnkey toolkits, either connected to an event or to the list we have available. But there is an opportunity, of course, to find a similar type image if you're interested in creating your own promotion. I know that I've worked with groups in the past who have done that. But we'll take this idea and suggestion into consideration, see what we can do, but at this time, we just don't have that available, unfortunately. So that's a great question, and we'll definitely include that to the group. Let's see. There's a general question in terms of the Healthy Worksite Summit scholarships, right? Who do we submit the scholarship request to? And the thing is that I know Pam mentioned that we have 60 scholarships to give out to everyone in PEBB that we support. And the way it works is that Pam, Aaron, and myself, we actually kind of divvy those 60 up. And so, not to get too into it, but we definitely take into factors such as who have we sent in the past years and, who might have a budget in place already. And then we kind of reassess and plan, who can we give one out to this year. But if you just have a general interest and you want to let us know, like, hey, I'm interested, you can definitely just submit your information to the Washington Wellness email inbox, and that'll help us kind of keep you on our radar as we start making plans. And we're going to start reaching out to you pretty soon, actually, to figure out who we're going to give these out to, because I know it's only October, or nearly end of October, but believe me, time flies, and that March date comes up quickly. So our hope is to get everyone in place with those scholarships by the new year, but we realize that things happen and things change, and we're always trying to do our best to help you guys out in those events. But if you're interested, send them along to the Wellness inbox. We have another good question. Maybe someone else on the team wants to answer. The question is, what are the points for with Smart Health? Anybody interested in answering that?
So I'll go ahead and take that one. So what are the points for?
Mm-hmm.
So that's a great question. So Smart Health is an online health and wellness portal. So it's something that's inherently online, and it's what's known in the wellness business as a points-based economy, and it's really based on the behavioral concepts that as sort of the gamification. So if you make something fun, and you make it interesting and make it sort of competitive, maybe with yourself, people would be more attracted to it and be more apt to actually use it. And so there's actually 3 levels within Smart Health. There's level 1, which is completing the well-being assessment. That gives you 800 points. And for PEBB members, subscribers, they at that point earn a $25 Amazon gift card. So for that 800 points, they get the $25 Amazon gift card. Taxes do apply on that. And then when level 2 is when you do level 1, achieve level 1 plus an additional 1,200 points worth of activities. So the activities range from 25 points to up to 500 points, but the average is probably around 75 to 100 points as far as the activities that are offered. That gets you to level 2, which is you earn the subscriber $125 off their medical deductible or deposit into their health savings account the following year by the end of January. And then, of course, when you 2,000 with level 2 plus 2,000 more points, the subscriber gets to achieve level 3, which is bragging rights, and they get a little icon. So it's really just more an intrinsic sort of good going, and keep up the good work. And so that's really what the points are about, is to motivate folks to participate in the program. It also, once they add up, they earn, you can actually qualify for those specific extrinsic incentives that are actually worth some money. And but we really hope folks, we know that for the long term, what really works is when people find value in it beyond just those dollar-based incentives. So thanks for that question.
So I'm scanning through the list. I mean, we'll give folks a few more minutes to submit any other questions, but it seems like that's all of them as of now. And I mean, if you have more questions down the line and you just can't think of it now, or prefer to think about it some more, you're more than welcome to submit them on the screen right here. You'll see the Washington Wellness email inbox, and then we'll do our best to get back to you quickly with an answer, right, to help you out.
Okay, well, and so before we just give a little bit more time, I'll say a couple closing remarks. That I just want to thank you all for coming to the webinar today. This is actually the second year that we've done this sort of preview. Last year we were able to do it in November, and now we're about approximately a month earlier in October, to give you an idea of what's coming up for next year. And so I just want to thank my team here for really pulling together to get all this stuff ready for you all, with the intent that you have it at your fingertips and can start using it to plan for the 2020 calendar year. So please let us know if it's helpful, and if it's not helpful, or if you have ideas for improvements, please do be in contact with us through email, or however else you want to contact us, phone number, etc. So I just want to say that I'm grateful for all the work that you do. We can only do a limited amount of work from our perspective. You're really the key to this whole thing working, as far as providing the workplace wellness support to your employees. And again, this isn't like this, weird concept or something that